On your tummy?
Yeah.
Okay.
So probably not as much, but I sometimes, like when I'm on my tummy, I almost feel like I have to hold my, like if I put a pillow here, I just feel like I want to hold my uterus in place. Does that make sense?
Interesting.
Like,
yeah.
I think at one time I feel like the vagina was falling.
Okay.
Does that make sense? Like,
Yeah.
I've had clients tell me this.
Yeah.
You're like, oh yeah, if I'm lifting things, you know, I feel something falling out of me and stuff too. And that does happen, right? As women age?
Yes, it absolutely, and not just with older women, or women that are around 50, 60, etc. Young women experience this as well, and women actually, what you're describing, if we had to put a term to it, would be just that
prolapse.
Exactly, pelvic organ prolapse. And so what that means is just that the organ, so this is the bladder, here is our vaginal canal, our uterus, our cervix, you know, the rest of our reproductive organs as females here, fallopian tubes, ovaries, and then of course we have our rectum. But vaginally speaking, there's a few different things that can happen. So the bladder sits, it's the first organ. If we're looking at someone from the side, and this is their tummy and this is their back, if we do like a cross section, their bladder is going to be first. It's going to be behind the pubic bone. Behind that is where vaginal canal to cervix to uterus sits, and then behind that is the rectum. So that's the order. So what can happen is, since the vagina is kind of in the middle, what happens is that sometimes the bladder starts to sag a little bit back into the vagina, and it can kind of, anatomically speaking, the front wall or the anterior wall of the vagina, that's where the bladder can start to push down and kind of start to fall down into that. So it's not, so yes, it's the bladder. If it's someone, and this is called a cystocele. So if someone has a bladder prolapse, it could be a cystocele, and if they see it, like you can literally visualize it, you're not necessarily seeing the bladder itself. All you're seeing is the bladder where it's pushing. Exactly, on the vagina, on the vaginal wall. You can also, to get a little more specific, you can also have a urethrocoele, which is the urethra itself starts to kind of come down a little bit too. You can have both, a urethrocystocoele. Also, the cervix, you know, some women experience this after childbirth. The cervix itself starts to come down through the vaginal canal. And then also the rectum. The rectum can push forward into the back wall of the vagina, and that is called a rectocoele. And then last but not least, this is a different type of prolapse. It's a rectal prolapse, and the difference with a rectal prolapse is that a rectal prolapse is actually the lining of the rectum comes out of the anal opening instead. But all of these are different types of prolapses that can happen. If a woman has had a hysterectomy, she can have a vaginal cuff prolapse, and that's essentially where she doesn't, if she's had a complete hysterectomy where the cervix has been removed, all the reproductive organs have been removed, the cuff itself can just start to, like the end of the vaginal canal that's been sewn up can start to come down. So there's different variations. However, with all that being said, once again, pelvic floor therapy is very, very beneficial, and oftentimes what can be the best for this is just learning how to use your breath appropriately, learning how to use what we call pressure management strategies to help offset and manage pressure inside of our bodies. Obviously having good strength, so strength training is super important. You know, if we have good upper body strength, if we have good lower body strength, then that's going to help take pressure off of our pelvic floors. If we know how to engage our core properly, all of that can really help too. So
oh, I'm so excited.
Yay! Awesome. All right, friends. So speaking of actually pelvic organ prolapse, have you ever experienced any pressure, heaviness, any of that falling out sensation before, Mary Star?
I would say yes. I mean, I can't put my hand on where that is now, but yes.
Okay, and also an interesting note, I think that all of you viewing this video will appreciate, is that you can have symptoms of pelvic organ prolapse, but it doesn't mean that you have pelvic organ prolapse. Also, I'll speak on that in a second, but also sometimes someone can have horrific pelvic organ prolapse symptoms, and the stage of their prolapse is very minimal. There's 4 stages of prolapse, so the way that us PTs grade it. So number 1 is the most minimal, number 2 is a little bit more moderate, number 3 is past the opening of the vagina, past the level of the hymen, and 4 is complete extrusion of the organ, essentially. And that typically does require surgery just because of risk of infection or skin breakdown, etc.
Yeah.
But I've worked with women before who have a stage 1 prolapse, so that's the most minimal, and they have horrific symptoms. They're debilitated by their symptoms. I've also worked with women who literally, I've seen stage 3 prolapses, and I've also seen a stage 4 before, where they had very little. They were just like, I just wanted to be back inside me, literally. That was what they were saying. And so that's important for everyone to know too, is that the severity of prolapse doesn't necessarily equal the severity of symptoms. So all right. I think we're about good to jump into our objective exam. So is there anything else you feel like is relevant or important to share with me regarding your health history or your pelvic health?
No, I mentioned in there too that I do have like a fatty tumor in my left.
I saw that.
And stuff too. And I'm like, I wonder if this is contributing to anything or just my offsetness, you know, chiropractically as well.
Right.
I do for quite some time too. If I get into gluten or sugar and or heat, I have like a red. It looks like a rash. It does not itch, but I have it here. I have it here. So I'm working with Dr. Kelsey with gut things to correct
work
that.
on that. Yep. Okay. And then the fatty tumor is on left side?
Yeah.
Okay. All right. And then Mary Star, a couple other things before we dive into our objective exam. I saw on your intake form here that your goal is, you know, of course, pain-free sexual intimacy. And this may sound like a silly question, but if you don't mind sharing, I ask all my patients this, so it's not just you, but share a little bit with me why that's important to you.
Okay. So, one is I love my husband and we are so happily married and we want to continue that. And we know that sexual intimacy is something that brings us closer. You know, it's important that we keep this part of our marriage healthy.
I love that. Thank you so much for sharing that. I really appreciate that. Okay. All right, so what we're gonna do is let's go ahead and get set up for the orthopedic exam. And then after that, we'll chat about a pelvic floor exam, and then my goal is to be able to tell you all of what I'm seeing and my findings, and then we'll go from there. Okay?
Awesome. I'm gonna stop this here.
No worries.